Hello there. Thanks for joining us today. My name is Ashley Abraham, and I'm an occupational therapist with Riverside Regional Medical Center. And I'm going to be joined by Lynne Groeger today, one of our oncology dietitians, to talk a little bit about prehabilitation and how it can prepare you for your oncology treatments and improve your overall quality of life. So what is prehabilitation? Prehabilitation is a supportive intervention that occurs from the time of diagnosis until you start treatment. So what is supportive intervention? Supportive interventions can be many things, including exercise therapy, nutritional support, psychological counseling, and education on lifestyle modifications that can help you through your cancer treatment. One particular lifestyle modification that we encourage people to consider is smoking cessation. So there are many benefits for stopping smoking when you start going through your cancer treatment, including that overall, it's going to help it be easier for your body to fight that cancer. It's going to improve your immune system function and overall improves the effectiveness of those cancer treatments. It reduces the risk of having complications related to your treatment, reduce the risk of having cancer come back in the future or developing other types of cancer. And overall, it's just going to be better quality of life by making that decision and seeking that help if you need it. There is a number at the bottom of the screen, 1-800-QUIT-NOW, if this is something that you are interested in learning more about. You can also reach out to your oncology team to see if they can provide any supports directly. So moving on to another type of rehabilitation service that we offer is going to be exercise prehabilitation. So this is going to be activities that are going to help improve your overall well-being that you start from the time of your diagnosis and continue as you go through your treatment to make sure you're as healthy as physically possible. So it may seem kind of daunting to think about adding new exercise program into your routine when you've just been diagnosed with cancer, but research shows that 85% of patients actually find that incorporating prehabilitation exercises is not only feasible, but a positive lifestyle change. And 0% report any negative results by adding that exercise. So even if it's not a huge change, overall, it's still going to be a positive direction by adding that exercise program in. So some of the benefits that prehabilitation exercise can have include higher potential for better functional capacity. So functional capacity is our ability to participate in our normal daily routines and the things that we want to participate in. So by having that exercise involvement, you're making it a better potential that you can do the things that you want to do, especially when you're going through those cancer treatments. There's also higher survival and better outcome results from surgical procedures when we start exercise prior to going through surgeries. And in some people, they've actually found that they have higher functional scores after they go through surgery when they start that rehabilitation before they go through that procedure. So if you actually end up being better health after everything, if you continue going through that exercise program from the start of your diagnosis and into your recovery. So some specific types of exercise programs that you can do. We've got a whole list of them here. I do want to say before I get into these, if you have any pre-existing conditions like heart disease or joint problems from arthritis, it might be good to talk to your doctor to make sure that you're doing the right exercises for you and that you're not doing anything too strenuous to impact your health negatively. But we're going to start with aerobic exercise. So aerobic exercise is going to be anything that gets your body moving and your heart pumping. So walking, swimming, cycling, it's all good stuff for your body. You're just getting out and moving. There's been a lot of benefits that have been found for aerobic exercise. And some of them include better tolerance to treatments like chemotherapy and overall shorter hospital stays and better recovery outcomes for those that are having, especially for those having lung surgeries or abdominal surgeries. The next two kind of go together. We've got resistance exercise and strength exercise. The resistance exercise can be self-resistant, so things like doing squats or push-ups. And then you could also use like a resistance band if you wanted to have something external from yourself. And then strength exercises we usually think of traditional like weightlifting, so free weights or using like a weight machine. There's a lot of benefits that come from doing strength and resistance training. That can be better tolerance to chemotherapy treatment. And then in general, just better results after surgery for mobility of your limbs. So for example, breast cancer surgery, sometimes people will have trouble with arm movement in their shoulder afterwards. And by starting these exercises before you go through surgery, you're likely to have better outcomes in the long run. So down in the bottom corner, we've got weight and impact exercise. This is kind of going to be combining a little bit of that aerobic and those resistance or strength training exercises. So we're probably thinking low impact exercises for this time frame. So low impact water aerobics, getting on an elliptical trainer. These are going to have the exact same benefits that we mentioned before. Better reactions to your treatments and better outcomes after your surgical procedures. Down at the bottom, we have balance exercises, and I'm going to kind of lump that in with flexibility and relaxation exercises because they do often go together. Balance exercises are really important for people that are having trouble with walking or their balance to begin with. If you're already having some issues with mobility, feel a little off balance when you're walking, or you need an assistive device to walk like a cane or a walker, it's probably important for you to go ahead and start doing some training with this, maybe even with the physical therapist, because you're going to have even more trouble if you have any side effect reactions from your treatment, and you're going to have a better long-term outcome and ability to get back to what you were doing before if you start early with getting those exercises. And then with flexibility and relaxation, we're going to probably think things like meditation, stretching, yoga. All of those exercises are going to do multiple benefits, including improved mental health and stress reduction, good mobility of those joints. Like I said before, if you're having surgery down in your lower trunk area or up in your chest, you want to have good mobility in your legs and your arms so that you have a better recovery afterwards. And overall, by following through those exercises, it's going to give you some peace of mind as you go through all of this process and all your treatments. And hopefully you'll come out the other side with a good outlook that'll help you with your recovery process. So now we're going to move on to Lynne, and she's going to talk to you a little bit about how nutrition can be, nutritional supports can be beneficial while you're going through your treatment.
Thank you, Ashley. My name is Lynne. I'm the dietitian at Riverside Cancer Care. And today we'd like to talk about the role of prehabilitation as far as your nutrition before and during your cancer treatment. So starting with a few key points, ideally we'd like you to roughly maintain your current weight. Now's not a great time to go on a diet or do anything terribly drastic. If you are underweight, certainly, see if you can try to keep eating well and maybe gain a little bit, but overall, no drastic changes, hopefully. Eating foods high in protein, such as fish, lean meat, poultry, milk, yogurt, eggs, will help your organs stay healthy and help you maintain muscle during treatment, which will definitely help you to feel a lot better. If you're a vegetarian, then focus on legumes, nuts, seeds, peanut butter, or other nut butters. And remember, the legumes are what people call dried beans, the starchy beans and peas like split peas and lentils and navy beans, pink beans, red beans, black beans, all those kind of things. They don't have to be dried. They could be frozen or canned to make things easier for you. We always want you to eat plenty of fruits and vegetables, especially because this is where the bulk of the cancer-fighting compounds are found. This is also a good time to try to balance your digestion if you can. If you tend to be prone to diarrhea, constipation, any of that type of digestive imbalance, now's a good time to work on that. And if you need any help with it, certainly just ask for your dietitian where you get your cancer care. We would also like you to communicate any supplements that you might be taking or would like to take. Vitamins, minerals, herbs, any kind of supplement. We just want to check to make sure that nothing is going to interfere with your treatment. Some supplements do, some supplements don't, some we don't entirely know, but it's a good conversation for us to have to make sure that you get the most out of your treatment. Planning ahead can make things easier for you during your treatment and beforehand. You might want to think about stocking up on fluids like bottled water, 100% fruit or vegetable juices, decaffeinated tea, clear sodas, ginger ale, and broth. You'll hear a lot about hydration before and during treatment, so getting yourself ready with fluids that you like to drink will be helpful. You also might want to have available easy to prepare healthy foods that you enjoy, things that require little or no preparation, such as peanut butter, cheese and crackers, tuna, fruit cups, single serving frozen vegetables that are easy to just pop in the microwave, cereal bars, granola bars, things of that nature. And with the granola bars, I might mention that ideally they should be less than 10 grams of added sugar, just so that we know that it's a healthy granola bar. Talking to family or friends about help with shopping and cooking or other things that you might need during your treatment can make things a lot easier for you. And definitely accept help when it's offered. People like to do things to help out. You would do the same for them. If you can give them kind of specific things like, here's my grocery list, or this is the day that I'm anticipating I'm not going to feel great. Could you, help me plan a meal? Something of that can make your experience during treatment much easier. And as I mentioned, hydration is so important for so many different things. It will help you be less fatigued. If you have any digestive issues like diarrhea or constipation, it will help that as well. We do generally recommend about 8 cups of fluids a day, 64 ounces, 2 quarts, however you want to think about it. Any fluid that's non-caffeinated and non-alcohol containing counts. So certainly water is best, but also if you need calories and other nutrition, 100% juices, milk substitutes, soup, ice cream, popsicles are all good sources of fluid. Even Jell-O counts as a fluid. A little bit weird, but it does count if you like Jell-O. And then eating enough calories overall to roughly maintain your weight will also help you feel better during treatment. We do expect at least 3 to 5 pound weight changes, just day to day, morning to night, etc. But overall, trying not to lose or gain more than about 10 pounds. And none of these are cast in stone, just some general guidelines to help you out. You may have a poor appetite even before you start treatment. And I have found over the years that really the time between diagnosis and actually getting started with treatment can almost be the most stressful part of all of this. And so you may have a poor appetite just because of all the new information you're trying to learn and prepare yourself for. So if your appetite is not great, any and all calories can become important, even if they're not the healthiest calories. Hopefully, the poor appetite, and usually is, temporary, and you can soon get back to eating healthy things. Taste changes are frequent and unpredictable, mostly during treatment, but this can happen beforehand. So really kind of paying attention to oral care, keep your mouth clean and healthy. And what patients tell me most that helps is rinsing your mouth before you eat. You can use plain water, water with salt, water with baking soda. Water with lemon is popular and useful because it kind of gives your mouth just a clean, fresh start, helps your taste buds get cleared out, and can help your foods taste better for, at least 10, 15, 20 minutes. Might not last long, but it might be enough to help you get some, good, healthy nutrition in. So that's a bunch of stuff on nutrition specifically. Prehabilitation overall, as Ashley spoke about, and then the nutrition part can help with better outcomes over a 5-year period going forward. The opportunity to be actively involved in your treatment plan can reduce length of hospital stays if that happens, reduce post-treatment complications, will definitely help to enhance your recovery following treatment, enhance your overall quality of life, improve cardiorespiratory fitness, improve your nutrition, and improve neurocognitive function. So I hope you learned a few things today. We really appreciate you watching and listening, and certainly let us know anything that we can do to help you. We're here for you. Thank you.